Hello, this is Dr.Serkan. I'm a plastic surgeon working in Istanbul, Turkey. Today I will try to explain you an important topic. Everybody before the surgery they ask me the same question. Should I gain weight before the surgery, especially if it's a BBL surgery? So the answer is simple, but to understand the answer you should know something about the fat physiology and fat metabolism. So if you are an adult, you usually have 10 to 30 billions of fat cells in your body, but the distribution is different. In some people they have most of the fat cells in the belly, in some people they have most of the fat cells in the hip areas. It changes, but it's up to your genes. The fat cells does not replicate in your life except two terms. One, when you were a baby. Second, when you are in puberty. In puberty and in babies, they have fat cells and they can replicate in these terms. But when you become an adult, your fat cell numbers are constant, they don't change. So we know that the fat has only two basic biological mechanisms. They always grow or they just shrink. Okay, so growing and shrinking. They only have these biological behavior. So if your numbers are not changing and if you're just gaining weight, it means that your fat cell numbers are the same, but the volume of the fat cells are enlarged. So is it useful for us in the surgery? The answer is not much. So let me tell you one more thing. When we are talking about the surgeries, I mean the liposuction surgeries, we talk about the volume. For example, we take 2 liters of fat from you, or we just transferred 400 cc of fat to each buttocks. So this is just the volume. It doesn't mean the fat cell numbers. For example, I can transfer maybe 1 billion of fat cells in a very small amount of fat. But sometimes I can just only transfer half of it with 2 times bigger volume. So the important thing about the result is alive fat cells that can be transferred to your buttocks. So for me, the main goal is not only transferring big volumes. Sometimes I can achieve very nice bodies with a small amount of fat transfer. For example, with 300 cc for each buttocks, we can make a big change, because the change is not only the size. The people always think about the sizes. Bigger buttocks, more shaped buttocks, yes, but the shape is, for me, coming from the proportion. So it doesn't mean that you're going to have a very huge diameter of butt. The important thing is, if you have a smaller waist and if you have a more proportional butt, it gives the hourglass shape. So the main goal is not to transfer a very big amount, just to take from the correct place and transfer it to the correct place. So if you ask me if I should have to gain weight, the answer is do not gain weight if you're going to lose it again, because you're going to lose the weight from your fat cells. They're going to be shrink again, so you will lose the volume in the buttocks. So when you are preparing for a surgery, just be careful. You have to come to your surgeon in your ideal weight. Liposuction will not change your weight. You're not going to lose weight after the liposuction surgery. Your only proportion is going to change, and the distribution of the fat cells will change. We will take from the flanks, we will give to the buttocks. So just the distribution changes. Your weight is going to be stable. Only the 50% of the result in your surgeon's hands, but the other 50% of the result is up to you. If you just keep that figure, if you just keep that shape, then you will have to be happy in all your life. The best choice for the patients is just to make a consultation before the surgery. Do not try to lose so much weight. Do not try to gain so much weight after surgery. Just do your consultation before the surgery, and your surgeon will definitely tell you that your fat amount is going to be enough or not. If you have enough fat, if you have enough reserve of fat, then you will have a nice result with a BBL surgery. If not, we have some other tools. I mean, we can use some implants, we can use some silicone injections. They're just going to be another video, but anyway, just make the consultation try not to gain so much weight if you're going to lose it, and try to choose the best surgeon for you.